it's hard in general. It's hard to talk to somebody that you've never met before. It's hard talking about material that we don't always go around talking about. So even just starting right now, if you check in with yourself in terms of just how uncomfortable you are, if 10 is super duper uncomfortable and 0, it's fine, this is whatever. How are you doing at this moment?
I think I'd be at like a 7. I don't talk to people about this, but I have been in therapy before, so like a 7.
Mm-hmm. And just so we have starting to get some language, what does that mean to you? Where do you feel a 7? Like at this moment, some people are like that. Their chest is really tight. Some people heavy in their head. What does a 7 feel like for you?
My heart's kind of racing and I'm getting kind of hot.
Mm-hmm.
So, yeah. And I feel like I'm shutting down a little. Like I don't really want to talk about this.
Right. Well, okay, that's super helpful and something we could just kind of track throughout our session if you're really noticing it, like, oh, we just hit a 10, or we'll just kind of check in on that if that's okay with you.
Okay.
So, from your intake, you specify that you're looking to work on hair pulling,
Mm-hmm.
and in particular, you mentioned pulling on your scalp.
Mm-hmm.
And you also mentioned that you have a friend's wedding coming up.
Yeah.
Question: If your friend's wedding weren't coming up, or you didn't have to get your hair done for that, would you be here?
Maybe not right this second, but I just hate that it's always on my mind. Like, if there's a trip coming up, like, my first thought is, where am I going to get ready? And who's going to be there? So I probably would have, but this is, like, a strong reason why I'm here.
Okay. So, just a little psychoeducation, because people come in lots of different levels of knowing. Have you done any reading about hair pulling, or have you...
That's a good question. I actually avoid it.
Mm-hmm.
So my mom sends me links and things, but I just like don't read them, and I'm kind of in denial about the whole.
And it's a perfectly normal reaction that people when there's something we don't want to think about, we tend to not want to read about it. And so let me just kind of give you a quick psychoeducation on what it's about. So hair pulling, skin picking, nail biting. Since we've been sitting in here, I probably did this a bunch of times. I'm like doing this right now. So kind of fidgeting and moving around with your body, they're all considered body focused repetitive behaviors. So you might hear BFRB if you do end up doing any reading. So, and they're all normal behaviors. They're considered grooming behaviors. So if you'll see monkeys at the zoo maybe, and they're picking at their loved one's skin, and it's a good thing. It keeps us clean, it keeps us from having little nits, and these are all good things. Some people's brain get a little more overactive and really enjoy it and think it's really, really important to get rid of dead skin and to get rid of weird pokey hairs or things that don't belong. And so some people's brain just find it a little more reinforcing and a little bit more important. So if you looked at an fMRI, it'd be lit up a little more in that section of like, wow, this is really important and something I really need to do, and it feels really good when I get it right. So it's not unhealthy in any way. In fact, these are healthy behaviors. The only time it's unhealthy is when somebody defines that, this isn't working for me because I don't like how this looks, or this isn't working for me because I spend so much time doing that. My hands are getting early arthritis, or I'm getting an infection in my hands because I keep pulling at my nails, so I don't want to do that anymore. There's nothing wrong with it unless it's not working for someone. So how does that feel to kind of be hearing that information?
That makes sense. I think it's gotten to the not healthy zone for me because of my bald spots.
Okay. And in terms of kind of level of shame, some people come in feeling like, well, it's something I do and I don't want to be doing it, and it's just time to work on it, and that's okay. It's just time to work on it. Some people come in with a lot of, I'm doing something that's wrong and that I don't want to be doing it, I keep doing it, and
I'm closer on that end, I think.
Mm-hmm. And anything that comes to mind as we're talking about kind of like maybe the shame or self-judgment that comes up with it? for you?
Yeah, because I always tell myself I'm gonna stop,
Mhm.
and I'm not able to. So I just feel like people can stop things that they don't want to do, and I just can't.
Like, what comes to mind when you think of that people can stop, things that they don't want to do?
Like it might be hard for them, but
Mhm.
not impossible, and it feels like I'm just different and I can't stop,
Yeah.
despite trying frequently.
Yeah. And what's coming up for me when I think about the fact that our country, maybe our obesity rate is 60%, and how many people know it's not a good idea to eat that extra cupcake or to eat those french fries, or it is a good idea to go to the gym after work versus sitting on the couch, yet how hard it is to do the healthy thing. It's the complicated part is not that people don't know what they should be eating or what's healthy. It's just sometimes really hard to do the thing that's the right thing to do. Do you see any similarities or any differences between those examples?
Yeah, I guess because there's such an immediate consequence for me. Like if I pull hairs, there's more of a bald spot that I can see it more quickly. That the consequence is there.
Okay, yeah. Is what would you give your rating at this moment? Or
I think 10. I hated that.
Yeah. And it's brave and that you even did that. So that's
Yeah.
the only thing that comes to mind right now is like it's really hard to do this kind of stuff. Are there any thoughts for you that come up with the 10, with the discomfort at that moment?
I just want it to be over, want it to be over, want it to be over. Like the woman that does my extensions, I've been seeing her for 4 years and we don't talk about it. She knows obviously, but we don't say anything.
Yeah. Is there anyone that you do talk, anyone in your life that?
My mom, but she just is it getting better? And I just say, yeah, Mom, it's getting better.
Okay, got it. And so tell me about your earliest experience polling. How what's the first memory that you have that comes to mind?
I remember 10 years ago, I felt this really curly hair, and I have straight hair, so I thought it was really cool, and I pulled it out, and I showed all my friends, look at how curly this hair is, and I started to look for those curly hairs, and it started from there.
Do you, and that first hair, do you remember where it was? Where did you find it? Was it underneath? Was it?
Yeah, it was down here.
And was it texture any different?
Yeah, it was much different, coarser and just curlier.
Yeah. And so you said that was around 10 years ago?
Yeah.
Okay. And how did people in your environment, did your parents ever notice that you were doing the behavior pulling?
Yeah.
What did they say?
My mom pretty quickly wanted me to be in therapy.
Okay. And so from your intake, it looks like you tried a few times and nothing seemed to work. And
yeah, it was none of them had hair pulling background, Trichotillomania background, so it was mostly just talk therapy.
Got it. Okay. And what on your own have you been trying to do?
Nothing really. I just try to tell myself to stop, but I don't really do anything.
Okay. Well, that's something that you're trying, is saying stop.
Yeah.
So you're trying that. We already established that doesn't tend to work.
I did try logs once, and it didn't really work because I would catch myself a few hairs in, and I didn't know how to count them, and I just really didn't want to log anyway.
Yeah.
I just wanted to
well,
avoid
good for you that you tried that. Where did you even get the idea to do that?
One of my past therapists.
Okay. And how are you? Some people really like keeping track of things, and some people, the thought of having to take notes feels super duper frustrating. Are you somebody who doesn't mind kind of documenting and tracking, or somebody who?
I'm really organized.
Okay, so
I'm an event planner, so.
Oh, okay.
Yeah.
So that's good to know. So that idea of keeping track of things isn't awful for you if it didn't feel so hard with this topic.
Yeah, it's just the topic.
Okay, good. So in in the past week, if you had to measure, approximately how many hairs, and sometimes it's just guesstimating, if you had to guess, or it could be how much time, any measure of either how much time you're engaging the behavior or how many hairs, and often people don't know.
I don't know.
Okay.
Yeah, I don't even have a guess.
Yeah, and that's a very common starting point.
Mhm.
So the first step in changing a behavior is trying to get a better idea of the behavior. So we sent you an invitation to NeuroFlow. I don't know if, I know we sent you a lot of information, so
Yeah, I got that.
Oh, okay.
Mhm.
Did you have a chance to download the app?
Not yet. I didn't know what it was, but
Okay.
I will.
So actually, even while we're sitting here, if you don't mind downloading it, kind of your first homework assignment is going to be to start just keeping a log throughout the next week, so we can start figuring out what when the behavior is happening. We'll talk more about it now,
Yeah.
but then we'll also get some of that data. So I'm assigning you right now
Okay.
it's called a BFRB tracking log, and so you could just keep the same log,
Yeah.
and then we'll go over the next time we meet. Is that
Okay.
something that you're willing to do?
Yeah.
And do you tend to be more of a paper person or using your phone or computers to
Phone
track
and
things?
computers, fine.
Okay, good.
Yeah.
Perfect. So if we had to kind of start looking at this behavior, there are different factors to consider. So first of all, different locations. We already know the location where right now you're pulling. Do you pull
Yeah.
anywhere else in your body?
No.
Okay. And what let's talk a little bit about what the behavior looks like. So for some people, they might be using their left hand. Some people, they're using the right hand. Some people, they kind of, depending on how they're sitting, they use both.
I always use my right hand.
And so right now, if you feel that spot with your left hand right now, what's that experience like to be using that hand to touch that spot? Is it feeling any urges, or does it just feel kind of wrong?
I'd rather be doing it with my right hand.
You'd rather,
Yeah. But
You
I'd still could pull right now.
you could, okay.
Yeah.
But it doesn't seem like you're using your left hand at all.
No.
Okay. And actually, if we were to really slowly break down the behavior, sometimes it starts with just kind of feeling around a little bit. What do you consider the first sequence of the behavior? And you might not even know this, so let's slow it down together.
Yeah. I don't think I know because I catch myself when I'm already doing it.
Okay. So why don't we right now, I mean, our goal is not to have you pull right now, but if you end up pulling, that's okay too.
Okay.
But if you just kind of touch that area and let's just kind of notice, it's awkward, so I'll pretend I'm not looking, but I'm really looking.
Okay.
What is your hand, what do you notice that your hand's kind of doing?
It's kind of searching.
Okay. And what fingers are searching?
I'm using my index finger and my middle finger.
Okay, I'm really bad with fingers. Index. Is an index a ring finger?
No, pointer.
Right?
Yeah, it's these two.
Yeah.
Okay. So you're using your index finger and your middle finger.
Yeah. Both
And-
together.
And are the other fingers at all touching right now?
No.
Okay. And is it just sort of like the fingertips that are kind of searching?
Yeah.
So not the whole, it's more like the fingertips
Yeah.
that are kind of, and what motion are they moving in? Is it circling? Is it just
Not really. It's kind of
dabbing?
random.
It's kind of searching though.
Yeah. Yeah.
Okay, and did it find one? Did they find one at this point that they would, if you weren't sitting here, maybe
Yeah.
want to get?
Yeah.
Can you show me kind of that kind of hair that it would? This
One right here.
Okay, that one right there.
Yeah.
And what stands out about that hair to your fingers?
Nothing major. It just doesn't feel right. A little bit, maybe a little thicker.
A little thicker, so that
Yeah.
coarse,
Yeah. Yeah.
the coarseness stands out.
And it was going in a little bit of a different direction.
Okay, and so maybe not. Now, once you find the hair, Some people kind of end up like twirling in their finger, twist it. There's some maybe like playing with it a little bit before they actually pull it. So what? Same kind of thing. Let's just notice what, if there's any.
I start to like pull the whole thing.
Okay.
Like, just to feel the whole thing.
Okay. And how long, I know this is sort of artificial time, but how long would you imagine you might do that?
Like, I don't want people to see me doing it, so probably like a second or two.
Okay. And then
I
what?
pull it.
And then you pull it. And then when you pull it, and you don't have to pull it now, but if you do, that's okay too. What would then happen? For some people, they might take the hair and like poke the bulb, like on their lip. They might kind of poke their hand. Some people like bite the end of the bulb, like do you want to say the bulb? Do you like the white, the kind of the plump part at the end of the hair?
I usually touch that and like roll it a little bit,
and then you just kind of Okay, got it. Okay, so and last question, just sort of about the actual behavior. Some people, it's very focused, like, oh, I'm having such a stressful day, I just need to like go to the bathroom and like pull out some hair. And some people, they don't even notice until all of a sudden they look at their desk and there's a bunch of hair. And some people, it's a combination. For you, so it's focused versus automatic.
Yeah, I think both. Yeah.
So what we're going to work on is habit reversal training, HRT. So what, like any other behavior, to change a behavior, the first step is going to be starting to track it, to understand when it's happening, time of day, where. Is it more when you're in the car and you're stuck in traffic and you go like this, or you're sitting at your desk? What are the different emotions that might trigger it? For some, it's boredom. For others, it's stress. For others, it's trying to get work done and having a difficult time thinking and feeling overwhelmed. So we're going to want to know the different trigger emotions that might come up. We're going to want to know the trigger sensations, the sensory experience that we've spoken about, and anything else that comes to mind, because the more we break it apart, the more we can start creating change at different points in the process. So what we're going to do is a combination of stimuli control. So that's kind of changing up the environment to make it less likely to engage in the behavior. So if I'm sitting on my hands right now, I can't pull. That's not going to be a feasible solution, but we're going to find little ways to start changing up the environment. And for some people, that might be putting a tiny piece of tape on the fingers we identified, and we'll do that next session. And when you touch that area, your fingertips don't get that sensation. For other people, maybe it's by getting a new chair so that you don't have the armrest, so you don't end up sitting like this. And by sitting in a different kind of chair, your body posture changes. For some people, it might be taking a break after an hour when you realize 2 hours into doing work, when you're getting so mentally exhausted, that's when you're pulling. So we're gonna start finding little speed bumps so that you can, it doesn't mean you're not gonna wanna pull, but it'll give you some space to then choose, how am I gonna handle this moment versus automatically engaging in the behavior. And last thing, I just wanna kind of quickly demo this device, and then I'll send you some more information about it. It's called Habit Aware. It's a company out of I don't even know, and I have no financial relationship with the company, so I'm not trying to sell it, but a lot of our clients have found it really helpful. So what we're going to do is, if you just put this bracelet on, and you said you're mainly using your right hand, correct? So if you just put the bracelet on your right hand, is just engage in the behavior that we were doing right before you're about to pull, and just kind of keep your hand there, and it's going to tell you when it's learned that behavior, okay? So just kind of keep your hand up there, and just kind of keep doing that gesture. And also, sit in the way you would sit. Is this how you would sit if you were sitting at home or sitting on you mentioned you pull a lot of the couch, so say you're watching, okay, so do it from that angle, how you would be sitting. And just kind of keep doing it. It's going to learn that behavior. Okay, great. So it's got it. Now you can put your hand down, and now engage in the behavior again like you were just doing it, and it'll vibrate when it notices that you're doing it. Did you hear it vibrating? Okay, so that's all you need to do. Now,